Making Rounds Live, broadcasting and streaming live from the WIDU Community Room.
The We Do Radio Network, WAGR in Lumberton, WYDU in Red Springs, WEWO in Laurinburg.
Making Rounds Live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making Rounds Live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
Thank you so much, Ray. Welcome back to another episode of Cape Fear Valley Health's Making Rounds Live. This is a broadcast in which we focus on healthcare, wellness, and the services that are offered and available throughout Cape Fear Valley. I'm your host, Omega Jones. May is Stroke Awareness Month, and every second counts during a stroke. And knowing the signs, it can truly save a life. So joining us today, ladies and gentlemen, we have two experts at Cape Fear Valley Health. First, we have Dr. Mena Samaan. He is an interventional and vascular neurologist at Cape Fear Valley and the director of Neurointerventional Services. We also have Ms. Cathi Buie. She is an MSN RN, and she is with the stroke coordinator. Get it together. Stroke program coordinator at Cape Fear Valley Health. Now, due to the subject and the topics that we're going to discuss today, remember that this broadcast is for informational purposes only. This is not a time for you to go around and self-diagnose, especially with what we're talking about today. So what I want you to do, if you feel that you or a loved one, a friend, or someone may be suffering from something that we may discuss today, instead of taking matters into your own hands, what I want you to do is find yourself a healthcare professional. Dr. Samaan and Cathi, thank you so much for taking time out of your busy schedules to be with us today. Welcome to Making Rounds Live.
Thank you very
Thank
much.
you.
Now, Dr. Samaan, let's start with you. Tell the listeners a little about yourself, because we talked a little bit before the broadcast, and the role that you play at Cape Fear Valley Health, and what inspired you to pursue neurology and stroke care.
Yeah. Thank you for having me today, Omega. And I'm Mena Samaan. I'm the, as you said, as a vascular and intervention neurologist and the director of Neurointervention services at Cape Fear Valley Healthcare System. And my work focus basically diagnosing and treating strokes and other complex blood vessel disease in the brain and the spinal cord. What inspired me to pursue neurology was how incredible complexity of the brain and the opportunity to make a meaningful impact during some of the most critical moments in the patient's life. Stroke care is usually the most rewarding because a timely treatment can truly save lives and preserve independency.
Now, Cathi, it's your turn. You're not a newbie here at Making Rounds Live. You've been with us before. Tell us about your role as stroke program coordinator and how your healthcare journey began.
Well, initially, I was wanting to go into business, and in doing that, I initially worked at Highsmith in the business office there when it was a private hospital. With that, I got to know the healthcare professionals there, and their impact was profound on me and got me loving medicine and realizing that was what I wanted to do and pursue. And so that is what I followed. So Cape Fear Valley, Fayetteville, this is my community, my home. I was born at Cape Fear Valley, and everything that I do for the community to make that impact, to help those people, the caregivers, the patients, in the worst times of their life, and to make it where they can get through it, teach them, educate them, helping them every step of the way from the minute they get to the hospital, through that hospital stay, and then beyond during their recovery period.
Ladies and gentlemen, joining us today are two experts from Cape Fear Valley Health, Dr. Mena Samaan and Ms. Cathi Buie. She is an MSN RN. And Dr. Samaan is the interventional and vascular neurologist for Cape Fear Valley, as well as you heard earlier, the director of Neurointerventional Services. And Cathi is the stroke program coordinator at Cape Fear Valley Health. Now, Dr. Samaan, let's talk about stroke. For listeners who may not fully understand, what exactly is stroke?
Yeah, it's a very good question. A stroke is basically occurs when like a blood flow to a part of the brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Brain cells begin to die within minutes, which is why a stroke is considered an emergency, a medical emergency. Quick recognition of a stroke and the treatment is critical to improve the outcome and reducing the disability from the stroke.
What causes a stroke to happen?
So most of strokes happens actually because of the blood vessels supplying the brain is blocked by a clot. This is what's called ischemic stroke, and it's happened in around 85% of the cases of stroke. There is other types of a stroke when blood vessel rupture or burst and bleeds into the brain, which is called a hemorrhagic stroke. And several conditions can increase the risk for stroke, including high blood pressure, diabetes, high cholesterol, smoking, heart rhythm abnormalities, like what's called AFib or atrial fibrillation, and obesity and sleep apnea as well.
Dr. Samaan, many people hear the term mini stroke or TIA. Exactly what is a TIA?
So TIA, as the name says, it's a transient, I is ischemic, and A is attack, transient ischemic attack. So basically it's a temporary interruption of the blood flow to the brain that causes stroke-like symptoms, which often resolve within minutes and 2 hours. By definition, TIA actually shouldn't cause significant damage to the brain when we get an MRI, for example. Even though symptoms may go away, TIAs shouldn't never be ignored because it's a warning sign before a larger stroke can happen. So it's a potential to identify the risk factors of why this is happening and to prevent a bigger stroke from happening.
Ladies and gentlemen, May is Stroke Awareness Month, and as you heard the doctor say, every second counts during a stroke, and knowing the signs that can truly save a life. And in the studio, Dr. Mena Samaan and Ms. Cathi Buie. They are with Cape Fear Valley Health, and Cathi is the stroke program coordinator at Cape Fear Valley Health. If you would like to join the broadcast, what I would like for you to do is you can either call WIDU at 910-483-6111. Again, 910-483-6111. Or if you're watching the live feed on Cape Fear Valley's Facebook page, what you can do is leave the question in the comment section. Can I talk today, please? And Lindsay will make sure that we get those questions answered for you. And I'll go ahead and throw this in there as well. We are also streaming live on Cape Fear Valley's YouTube channel as well. So make sure you spread the word and share the broadcast. And again, ladies and gentlemen, our guests, Dr. Mena Samaan and Cathi Buie, and we are talking about stroke. Now, Cathi, why is Stroke Awareness Month so important?
Well, it is very important because we live in the area what's called the stroke belt. And in this area, strokes are significantly higher than anywhere else in the country. So raising awareness helps educate the community that a stroke is one of those things that can happen to anyone at any age, at any time, no matter where they're at, who they are, and recognize the warning signs, making sure they are paying attention to those warning signs, getting immediate medical attention, because like you had said earlier, getting that attention reduces their debility, reduces the the chances of something more severe happening and gets them back to their functional daily lives.
Kathy, I'm reading that more and more young people are experiencing strokes now. How common are strokes?
A stroke can happen, and statistics say a stroke happens every 40 seconds in the
Wow.
United States. And like I said, we are in the stroke belt, so it happens even more often than that here. And age, strokes don't care how old you are. They do happen in children. We've seen them as young as 18 years old, which is what our adult population starts at. Our average age of an adult stroke patient right now is about 62 for what we're treating, which is young. It is very young. So they are happening. We have doubled our stroke numbers just in the last 2 years, and it is every year rising. So strokes are happening more and more frequently. So getting that education out there to the public for them to know the risk factors, knowing the symptoms, getting the treatment as soon and as quickly as possible is so important.
I'm amazed at the numbers and the increase. That's amazing.
No, absolutely.
Cathi or Dr. Samaan, studies show that African Americans are at a higher risk for stroke and often experience strokes at a younger age. What are some of the factors, and piggybacking really off the question that I just asked, what are some of the causes of this, and once again, why is that awareness and that prevention especially important in the African American Black community?
So African Americans, they're about 45% more likely to experience a stroke and nearly twice as likely to die from one compared to other nationalities and races. So there's many contributing factors. There are the higher instances of high blood pressure, diabetes, the genetic factors, obesity, things that there are modifiable risk factors that they can contribute to and fix. Then there's also the genetic factors such as sickle cell disease that are more prevalent in the African American community as well. But high blood pressure alone is one of the leading causes of stroke, both ischemic and hemorrhagic stroke.
Wow.
And more than half the Black community is affected by it, and at a younger age. Not to also to include diabetes. We have a high prevalence of diabetic population here in this area. When you look at our comorbidities or the additional medical factors that our patients have, the three top medical factors that patients with our stroke population has, they are high blood pressure, they are high cholesterol, and diabetes. And those three are the top risk factors for stroke. And they are three of the top risk factors for African Americans as well.
Dr. Samaan, you mentioned the warning signs earlier and the symptoms. What should people actually look for?
Yeah. So warning signs for stroke is, as you know, stroke symptoms come typically suddenly, and any of the signs that we will put it in an acronym called BFAST, that should be going as a medical emergency. BFAST is starting with B for balance. Any balance or unsteady gait, all of a sudden you're unable to walk as you used to, or nausea, vomiting, severe imbalance problem with that could be a sign of a stroke. E stands for for vision. So any vision problems, so sudden loss of vision of one eye or both eyes, or even like double vision, like seeing things doubles. That also can be a sign of a stroke. Then F, like face, any facial droop, any asymmetry of the face, that could be a sign for stroke. And then A comes arm weakness. So any one side weakness, whether arm or leg weakness, can be a sign of stroke. Then comes S, which is basically speech. So any slurring of speech, unable to get the words out, unable to comprehend what you are talking about, that could be a sign of a stroke. And lastly is T, which is time. It's time to call 911.
And why is it so critical for us to respond quickly?
Yeah, so during stroke, every minute, blood flow interrupted, nearly around 2 million of neurons die. And not only that, is also the brain basically ages by approximately 3 weeks. So if we put this in 1 hour, so every 1 hour, nearly 120 million of neurons die, and the brain ages by 3.5 years. 3.5 years every hour if we're delaying stroke treatment. So the faster the patient receives treatment, the better the chance of saving the brain tissue, reducing disability, and improving the recovery.
Ladies and gentlemen, in the studio, Dr. Mena Samaan and Cathi Buie. They're our in-studio guests today on Making Rounds Live. Dr. Samaan, he is an interventional and vascular neurologist at Cape Fear Valley Health, as well as the director of Neurointerventional Sciences. Cathi, she is the stroke program coordinator at Cape Fear Valley Health, and we are so honored to have them with us today as we bring awareness during during Stroke Awareness Month. Now, let's talk about the symptoms, Cathi. What are the symptoms that people sometimes dismiss, or maybe they feel it's not that serious?
It can vary. A lot of times it's those very vague symptoms. The obvious strokes, people will come in for immediately when you can't feel your arm or your leg, or you have the obvious facial drooping. They know that that's a stroke, and they come in right away. But a lot of times it's the very vague symptoms that they will, that they will ignore, or the headache that they've never had before. They know something's wrong. They've never had this headache, and they will just brush it off or blow it off. Or the headache with the nausea and the vomiting, and they can't stop vomiting. They think it's just a stomach ache. And those are the ones that they come in, and at first, they're getting treated for a headache, and they're the hard ones to see. And a lot of times it's the women. Women, they don't know how to explain it. They don't know what to really say. I just don't feel right. Or they just feel dizzy or weak. So when they have these vague symptoms, they don't really realize they're having a stroke sometimes. Or even with the vision changes that Dr. Samaan was talking about, they want to just say, I got something in my eye. I mean, I have heard, in all the years I worked in the emergency room, I've heard so many different things, and they want to make all kinds of different excuses. They've used Visine for a week or so, and they've had a stroke, and they really will, blow it off and think of everything under the sun other than the fact that it might be a stroke. And it's concerning. But, getting that treatment when and, once they hear there's a stroke, and it's like, I thought something really might be wrong, but it's trusting their gut that something really is wrong.
Well, Cathi, when we return, I want to elaborate on women and stroke, because I want to know if the warning symptoms are different, or do they present themselves differently in women? But right now, ladies and gentlemen, Brother Paul is over there telling me I've got to take a break. So when we return, we'll continue the conversation on Stroke Awareness Month. Cape Fear Valley Health's Making Rounds Live. Make sure you stay close.
We'll be right back with more of Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live from the WIDU Community Room on 99.7 FM, 1600 AM.
The We Do Radio Network.
This is Dr. Ann T. Newell, pastor of the Soul Harvest Apostolic Church at 135 North Main Street in Spring Lake, and you're listening to Wake Up.
A federal court today blocked Alabama Republicans from implementing their preferred House map ahead of this year's midterms, potentially preventing Republicans from picking up an additional seat via gerrymandering. North Carolina is still facing major drought problems despite days of much-needed rain in some areas of the state. Iran has denounced U.S. strikes in southern Iran as a sign of bad faith and unreliability amid ongoing negotiations to end the war. Investigators believe Jonathan Phelps of Wake County allegedly cut the outer fence of a solar farm on Winter Road in Bailey in Nash County and took about 2,000 feet of copper wire. Tick season in North Carolina is a year-round threat, but peak activity occurs from late spring through early fall. The most intense biting period runs from May until September, driven by warm, humid climate. Mike Rayleigh, NCN News.
I'm Jamie Manaselli, WIDU Radio News. The North Carolina Department of Transportation will temporarily close a section of King Road beginning May 27th for construction of a new roundabout near the future Rockfish Village Shopping Center. That closure is set to remain in place through early July. Drivers are encouraged to use King Road, Mesquite Drive, and Stony Point Road as a detour during construction. The Cumberland County Sheriff's Office says 39-year-old Lindsay Pascal of Lillington has been identified as the victim of the homicide that occurred on May 25th in the wooded area at the end of Burrow Drive in Fayetteville. Her next of kin has been notified. Arrested and charged is 47-year-old Dominic Smith of Fayetteville, charged with first-degree murder. Smith was processed at the Cumberland County Detention Center and held on a denied bond. If you have any information about the investigation, you are asked to call the Sheriff's Office at 910-677-5463. From WIDU Radio, I'm Jamie Manaselli.
Another day with some of the most humid air of 2026 so far. That is going to lead to the chance for scattered afternoon and evening storms with high temperatures well into the 80s prior to the development of some of those showers and storms. Overnight lows, they'll drop into the upper 60s and lower 70s because of the humidity in place. And by Wednesday, well into the 80s once again, fewer storms compared to Tuesday. I'm meteorologist Chris Michaels in the NCN Weather Center.
Wake up, catch the vision, join the team. This is Pastor Reginald Johnston of My Father's House Christian Church right here in Fayetteville. We want you to wake up and join the team. Behold, how good and pleasant it is for brethren to dwell together in unity. It's good when we come together. We're one body, many parts. We desire that you wake up and join the team. It's good to be a part of Wake Up. Wake up, join the team. We will see you in Jesus' name. God bless you.
Remember the rotary phone? Well, soon that's what people are going to ask about gas-powered cars. And every day we see videos of robots becoming more and more like us. Welcome to the future. At Fayetteville State University, we believe that anything really can happen. So wherever it is that you want to go, we've got a program for that. Visit Fayetteville State University and find out how we're preparing students just like you for what comes next. Fayetteville State University. Are you in?
This is Apostle V.L. Whitfield of Righteous God Ministries, 2444 Owen Drive. You are listening to Wake Up.
This is Bishop Johnny Ray Jr. of the Churches of Worship Worldwide, Apostle J.A. McDonough, 2118 Owen Drive. And we are proud to be a part of the Wake Up. Come and join the team.
We now return to Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live on the WIDU network, 99.7 FM, 1600 AM. Here's Omega Jones.
Thank you so much, Ray. Welcome back to the second segment of Cape Fear Valley Health's Making Rounds Live. Folks, we are in the middle of an amazing conversation. May is Stroke Awareness Month. We are talking about stroke. We're talking about how you can prevent it. We're talking about the warning signs. And we have two experts with us today, Dr. Mena, Samaan, and Cathi, Buie. They're both outstanding experts in the stroke prevention and stroke care. And before we went into break, Cathi, we had mentioned that she was starting to talk about the different symptoms that women deal with and how women just basically, I thought it was something in my eye, or I figured something just didn't feel right. And we really don't associate all of these different feelings with medical ailments. So Cathi, before we went into break, what I wanted to ask was, stroke symptoms, do they differ in men and women, or are they basically the same?
Well, a lot of times stroke symptoms for women could be a little bit a little bit different. They can have they'll come in with just like fatigue or weakness will be their complaints, or just general not feeling well. They're more of what we call like an asymptomatic kind of stroke. Men will be a little bit more directive with their symptoms, but women are a little bit more asymptomatic, and a little bit different. It's kind of hard to tell you. It's almost like a mystery in some ways. And so it's a little bit harder at times. I don't know all the reasons. Dr. Samaan could probably speak to it a little bit better than I could. But we see the same thing at times with in emergency medicine with cardiac patients as well. But it makes it kind of difficult. But it's where I say, as a nurse, trust in your body and trusting yourself and advocating that something is wrong. Get seen, get checked out.
What should someone do right away if they think they're having a stroke or a loved one's having a stroke? I know we've already mentioned BFAST, and I really want to mention that again in case they mentioned it, they missed it during the first part of the broadcast. But why is time so important?
Time is brain. Time is absolutely brain, because you don't know where it's happening at, and so there is medicine that we can give depending on how severe the symptoms are. From the last known well of what's going on, we have just a specific amount of time that we can give the medication, get things going for the patient and the stroke survivor. So we want to make sure that we are on top of it, because you have 4.5 hours to get what we call the clot busting drug to neck to place, or if it is a large vessel occlusion, which Dr. Samaan can definitely speak to, getting them the care they need to get that clot removed. Time is brain. We want to make sure that they don't lose any more brain tissue than absolutely necessary, so we can get that reperfusion and get them back on the road to being functionable.
Is that also the reason why you stress that people should call 911 instead of driving themselves to the hospital?
Absolutely, absolutely.
When you're experiencing symptoms, and I've heard this so many times, this is the reason why I'm asking this, I'll just sleep it off. That is not a good idea, correct?
Correct. So stroke symptoms, as we talked about, should never be ignored or slept off, because again, brain damage can continue while treatment is delayed. Even if it's a TIA or the symptoms are resolved, that doesn't mean that it could be a warning sign before a bad stroke or devastating stroke is coming. So even if the symptoms are resolved, it's worthwhile to call 911 or get evaluation as soon as you can. Because again, the brain will get to develop damage even if symptoms are resolved.
You mentioned during the first break about the longer they wait, how the brain progresses. As far, I don't want to use the word deteriorate because that sounds too harsh, but you mentioned that if it's so many minutes, it ages. That's the word, ages. Could you explain that again for our listeners that may have missed it?
Sure. So basically, when every minute the stroke goes away or the blood not going to the brain, the nutrients not going to the brain, then around 2 million of neurons die, which means around 3.5 or 3 week and a half every minute the brain ages. So basically, because area of the brain is dying, then the brain ages. And every 1 hour or 60 minutes of not getting treatment, the 120 million neurons die. And at the same time, around 3.6 years the brain in age. So that's a lot of time that the brain in age, and even putting into consideration, because we don't know how many neurons we have, and it doesn't matter